Let's face it, guys, life can come at you pretty fast sometimes. As you get older, it's only normal that some things will change in terms of your health. And as a man, there are certain things that you are going to want to be on the lookout for as the years tick on. Wear and tear is natural, of course, but it is important to take proper care of yourself. And the first step is identifying what is going on with you. That's why today we are focusing on 10 health issues men over 50 will face, so you can be prepared for whatever is around the corner and limit how much it affects your life. Number 1. Prostate problems. For men over the age of 50, prostate issues are a very common occurrence. And because of that, it is recommended by most doctors that men regularly get prostate exams to make sure there aren't any issues down there. Conditions like BPH, or an enlarged prostate, affect almost all men as they get older, and they can come with some irritating side effects such as feeling like having to use the bathroom all the time. They can also throw your internal systems off, and among the issues that men face as they age, prostate cancer is one of the most common. Because of this, you are going to want to keep an eye on your bathroom habits as well as your digestive ones as you continue to get older. The good news about prostate problems is that they are usually pretty easy to treat, but you have to be vigilant, or else they can balloon into a full-scale dilemma that could limit your treatment options. Number 2. Bladder cancer. Your bladder, as you most likely know, is a hollow muscular organ located next to your prostate, and it is responsible for holding your urine. We usually don't really think about the whole process all that much though. That is, until something happens. If you are experiencing back pain, frequent or painful urination, or you are finding blood in your urine, you may be experiencing symptoms of bladder cancer. This form of cancer is usually caught pretty early, thanks in part to the symptoms being pretty obvious and alarming. Bladder cancer has shown an ability to come back, and those that shake it are often advised to come back for future tests to make sure it hasn't returned. Bladder cancer is common in men, but sometimes people will mistake symptoms of bladder cancer for a prostate issue and not treat it with the urgency it deserves. Number 3. Testicular problems. The effects of aging can be very different between the sexes, and a lot of men don't even really realize what some of the clear signs are. For example, did you know that the aging of the male reproductive system presents itself mostly in the testicles? It's true, and it can affect your hormonal balance, how much semen and sperm you are able to produce, and a decline in fertility. The testicles also tend to descend farther as you get older, which can result in discomfort for some and adjustments to everyday processes such as sitting down or using the toilet. Ultimately, the testicles are where you may experience a strange sense of aging as you adjust to newer conditions, but it is something that all men go through when their body starts to slightly slow down. Number 4. Impotence or erectile dysfunction. Some studies have indicated that over 52% of men experience erectile dysfunction at some point in their lives. Impotence in the bedroom can be embarrassing, but it isn't necessarily your fault. As your body stops producing the same amount of testosterone as it once did, you are bound to experience some side effects, such as weight gain and a harder time packing on muscle at the gym. Just like how those are natural reactions, so is erectile dysfunction. It also doesn't really matter what your libido was like before the change, as it can impact almost any man. That doesn't have to mean that you can no longer enjoy a sexual experience, however, as there are countless medications and lifestyle options that you can explore in order to regain control of your libido. It may take a bit of time to figure out what is the right choice for you, but understanding that there is something you can do and that it impacts many men every year is valuable insight. Number 5. Incontinence. Incontinence is the term for when you lose control of either your urinary function or your bowels, causing you to expel urine or feces involuntarily. Becoming incontinent can be a major point of shame, but it is fairly common in males, although it usually doesn't affect men until they are in their 70s. Depending on factors both in and out of your control, you may be faced with this issue as early as your 50s. If this is the case, there are steps that you can take in order to regain control, and one of them is limiting the strain on your bladder. An enlarged prostate can lead to incontinence, since the weight of it on your bladder forces urine to be expelled. Getting your prostate under control and making good choices with your food and drink intake can help you avoid this issue and remain in control of all your body's functions. Number 6. Heart disease and high blood pressure. Heart disease is genetic, and if it runs in your family, you are definitely going to want to take the proper precautions in order to lower your risk of it. That kind of advice is preached so often, however, that those that do not have a family history of high blood pressure or heart disease can often believe that they are completely safe, but this is not at all the case. Factors such as your diet and any habits like smoking or drinking can increase your chance of developing heart issues, especially as you get older. Heart disease is one of the biggest causes of death in the world, and too many people don't take proper care of their heart. Limiting sodium intake, getting rid of inflammation, and regularly exercising are all simple and effective ways to keep your heart pumping at full speed, and they will also help to improve your overall quality of life at the same time. Number 7. Respiratory diseases. Smoking is an awful habit, and it can cause more than inflammation or heart disease, such as respiratory diseases, for example. We tend to, at least generally, not pay much mind to the air quality that we are breathing in, but that can also result in potential breathing difficulties over the years. The same goes for being in buildings with mold, asbestos, or other airborne pathogens that can damage our respiratory system. Men tend to experience these issues at a higher rate than women on average, so it's important to be mindful of your surroundings at all times. Another cause of respiratory disease in men is the result of weight gain. When you gain weight, it can sometimes make it more difficult to breathe, causing complications in one of your body's most essential and frequent processes. Losing weight can alleviate this issue, but it's important to make sure you are properly taking care of your lungs as well as being critical of what you may be inhaling. Number 8. Diabetes. There are a lot of symptoms that may point to you having diabetes, like feeling thirsty all the time, finding protein in your urine, or losing weight without even trying. With modern medicine, diabetes is less of a health risk than it has ever been, but it is usually when you are undiagnosed that you can experience the worst of it. That's why it's important to check in with yourself every now and then, to make sure that nothing is flying under the radar that you may not be thinking about in your busy life. Diabetes can have some pretty serious outcomes if you let things go too far. And in comparison, the treatment and lifestyle changes aren't that bad. Men who have diabetes can also experience erectile dysfunction too, so there are a lot of reasons to be on the lookout. Number 9. Influenza and pneumonia. When you get sick and your body is a bit older, the side effects and repercussions can be quite severe. Things like influenza and pneumonia both carry long-term side effects with them, and these can really hamper your quality of life. You have to be careful not to put your immune system in compromising situations, such as getting soaked in the rain or standing out in the cold too long. These haven't had any negative consequences for most of your life, but they can unfortunately have serious health implications if you don't take proper care of yourself. Number 10. Emotional health problems. Not all of the health issues you will face involve your body. There are both cognitive as well as emotional health problems that you are also going to have to deal with in order to remain content and healthy. Our mental health, as well as our emotional health, are huge contributing factors to our overall quality of life, and without them, we can have a hard time keeping up. Depression is extremely common in senior citizens today, and this issue is much bigger than most people give it credit for. You have also lived a whole life by the time you have turned 50, so it makes sense that there is some baggage there. In order to take care of your body, you must first truly want to continue, and if you are struggling to manage your emotions, the journey is going to be much more difficult. There are countless strategies that you can employ to keep your emotional health in check and secure, including meditation or yoga, therapy, or even support groups. Finding people like you can help you to open up and relate more, and could be very helpful. Here are 2 more videos you may find interesting. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.